What is Neo-Ayurveda? First time in the history of Ayurveda, Dr. S.M. Raju blended allopathic medical science with Ayurveda. Like in allopathic science, taken the principles like diagnosis, dosage and administration, blood thinning, cholesterol maintenance, rejuvenation of gut beneficial microbes, and from Ayurvedic science taken the medicinal herbs to nourish the undernourished organs, and diet, meditation for activation of hypothalamus gland and other endocrine glands, and pranayama for lung exercise. By studying through Vedic literature as a passion for more than 40 years. Unlike traditional Ayurveda, Neo-Ayurveda pioneers specific diets and treatment plans with health supplements for various incurable health disorders. In Ayurveda, purified metals are being used in many formulations. Neo-Ayurveda opts for herbal extracts. These medicinal herbs rejuvenate organs by clearing blockages in tiny blood vessels and are connected to cells for supply of nutrients, hormones, and oxygen, for nourishing while aiding in removal of toxins and carbon dioxide. A unique aspect absent in current medical science. Crafted from Vedic literature, Neo-Ayurveda created 30 unique and 100% herbal formulations, excluding purified metals, out of which 10 formulations in combination address more than 170 incurable and chronic health disorders. Like in allopathic science, blood thinners, statins, beta blockers, omega-3, omega-6, fatty acids, and supplements. In Neo-Ayurveda, as per Chakra Ahar Hai Parama Aushadam, the approach is: the food is medicine, as per Greek physician Hippocrates. Let thy food be medicine, and medicine be thy food.